Now, when we talk about diabetes, it is a chronic medical condition where the body is unable to regulate the amount of glucose in the blood. Whatever food you eat into your body ends up as glucose. So it doesn't matter whether you ate shawarma, you ate pizza, fried rice, banku, fufu, whatever food you eat into your body eventually ends up as glucose. So imagine you eating in the morning, afternoon, evening, the amount of glucose which is in your blood. So your body needs to regulate this amount of glucose in your blood. Now, this is how the body does. There is a hormone in the body called insulin. The function of the insulin is to transport this too much glucose in the blood into the cells. So the insulin acts like a key. It opens the door of the cells so that it will transport much glucose into the cells so that the cells will metabolize it for you to get energy. Now, let us look at the types of diabetes. We have type 1 diabetes and we have type 2 diabetes. When we talk about type 1 diabetes, it is an autoimmune condition where the body is unable to produce enough insulin. So remember, in type 1 diabetes, the body is unable to produce enough insulin. Have it in mind that the insulin is the one transporting the glucose to the cells. So if there is low or no amount of insulin in the blood, that means there will be too much glucose in the blood. So that is the first type of diabetes. So now let us look at the type 2 diabetes. In type 2 diabetes, the cells of the body are not sensitive to the insulin in the blood. So this means that in type 2 diabetes, there is abundance, there is too much insulin in the body. However, the cells of the body are not sensitive to the insulin. So that one too will lead to the buildup of glucose in the blood. What are the symptoms you will notice when you have diabetes? The first one is polyuria. Polyuria is you urinate frequently, frequent urination. You also have polydipsia. Polydipsia is frequent thirst. You always feel thirsty, so you'll be drinking a lot of water. We also have polyphagia. With polyphagia, you begin to eat, you eat a lot. You eat a lot in short duration of time. I hope you understand. That is polyphagia. Then we also have fatigue. You become, weak, in very short period of time. We also have poor wound healing. There are majority of people who have diabetes that when they have a cut or a wound on their body, it takes a very long time for the wound to heal. So these are the symptoms you notice when you have diabetes. So once you notice all these signs, you notice even one or two of these signs, you need to get to the hospital for further management. Before we look at the causes of diabetes, I would want us to look at the complications associated with poorly controlled diabetes. If you have diabetes and you don't pay keen attention to it, these are the likely complications. One is nephropathy. Poorly controlled diabetes can affect your kidneys, and in return, it leads to kidney failure. Also, it can lead to retinopathy, where it affects your eye, the nerves of your eye, and that can lead to blurred vision and sometimes complete vision loss. It can also lead to neuropathy, where it affects your nerves, the nerves of your hand and legs. That is why majority of the times people with poorly controlled diabetes will come with complaints of numbness or stiffness in the hand and legs. These are likely complications associated with you not taking keen attention to your diabetes. I hope you understand. Let us look at the causes of diabetes. With the causes of diabetes, we have modifiable risk factors and then non-modifiable risk factors. So with the modifiable risk factors, it is alongside with the lifestyle modifications. However, with the non-modifiable risk factors, you can't do anything about it. So some of these non-modifiable risk factors is family history. If you have a family member who have been diagnosed of diabetes before, it puts you at a higher risk of you to having diabetes. Also, age. As you grow, it predisposes you into having diabetes. This particular type of diabetes, which goes alongside with age, is type 2 diabetes. Let us continue with the management of diabetes. How do we manage diabetes? The medications being given in the treatment is dependent on the particular type of diabetes you have. If you have type 1 diabetes, the medication to be given to you is different from someone who has type 2 diabetes. So for people who have type 1 diabetes, because the body is unable to produce enough insulin, we will give you injectable, soluble insulin, so that you'll be injecting it into your body, and that one will increase the amount of insulin in your body so that the insulin will now transport too much glucose into your cells. That is for those who have type 1 diabetes. For type 2 diabetes, because the cells are not sensitive to the insulin, we will give you certain medications called sensitizers. These sensitizers include metformin. So once you take these sensitizers, it will sensitize the cells. It will make the cells very sensitive to the insulin. so that in return more glucose will be transported into the cells. There are also many diabetes medications. However, basically these are the two medications for managing these two different types of diabetes. Also, if you're one kind of person who have been diagnosed of diabetes, you need to be checking your RBS or your FBS, which is your blood glucose, all the time, because at some point your blood glucose can come high, at some point it can get low. So if you are being diagnosed of diabetes and you are on medication, you need to be monitoring your glucose level all the time so that you know the level of your glucose at any point in time. So now, what are the prevention? How do you prevent diabetes? Prevention is based on the modifiable risk factors. If you are one kind of person who want to prevent yourself from diabetes, then you have to ensure that all those modifiable risk factors, you put that into practice. So you need to reduce intake of sugar. Also, if you are obese or you are someone who is too big, you need to cut down your weight by exercising. I hope you understand. You need to also have a very good, a balanced diet. There are also certain kind of medical conditions that predispose you into having diabetes. So if you are someone who have been diagnosed of PCOS, which is polycystic ovarian syndrome, that one too predispose you into having diabetes. So you need to go for medical management and care so that they will manage the PCOS or the polycystic ovarian syndrome for you so that it will not predispose you into having diabetes. I hope this video is very, very helpful for you. Subscribe to this channel for more videos, like this video, and then share this video to many people. There are a lot of our family members, our friends and neighbors who need a lot of in-depth and knowledge about diabetes. That is why this video, it is very, very important that you share this video with most of them so that they too will be informed about this particular topic.